Let's have an honest conversation, one that you've probably never had with your doctor, your partner, or even your closest friends. It's about a behavior that is completely natural, incredibly common, yet so often shrouded in silence, shame, and a quiet, persistent worry. I'm talking about masturbation. And more specifically, I'm talking about the question that I know lingers in the minds of millions of men, especially as they get older. It's a question you might have typed into a search engine late at night, or a thought that flashes through your mind when you hear the words prostate cancer. The question is this: is this very private, personal act somehow increasing my risk of one of the most feared diseases a man can face? Is it secretly harming my prostate? For too long, the answer to this question has been buried under layers of myth, cultural taboo, and frankly, a lack of clear communication in the doctor's office. You deserve better than that. You deserve the truth, based not on old wives' tales or moral judgments, but on actual modern medical science. And that is exactly what we are going to talk about today. We are going to bring this topic out of the shadows and into the light so you can replace anxiety with knowledge. My name is Dr. Evelyn Ross, and I am a urologist. For decades, my life's work has been dedicated to the health of the male urinary and reproductive systems. The prostate gland is something I think about, study, and treat every single day. And in all those years, I've seen countless men in my clinic who are carrying around a silent burden of worry. They're worried about their PSA numbers, about getting up at night, about cancer. And woven into all of that is often this unspoken question about their own history, their own habits. That's why I'm making this video. I want to be the doctor who finally has this conversation with you, openly and without judgment. We're going to dismantle the old myths, look directly at what the best scientific studies tell us, and by the end of this discussion, you will understand the real relationship between ejaculation and the health of your prostate. More importantly, you'll know exactly where you should be focusing your energy to genuinely protect yourself. So let's begin. First, to truly understand this topic, we need to understand the prostate itself. I know most men just think of it as a small, troublesome gland that causes problems later in life, but it's a remarkable piece of biological engineering. I want you to think of your prostate not as a simple walnut, but as a highly sophisticated, constantly working factory. Its main job, its entire purpose, is to produce a milky, nutrient-rich fluid. This isn't just some random liquid, it's a vital component of semen. It's what nourishes and protects sperm, giving them the best possible chance to fulfill their mission. This factory is always online. It's always producing day in and day out from puberty onwards. Now, what happens in any factory that's constantly producing a product? It needs to ship that product out. If shipments stop, but production continues, the warehouses get full. The production lines get clogged. Things can start to go wrong. The factory becomes inefficient and stressed. Just hold on to that analogy of the prostate as a factory with a product that needs to be shipped. It will become very important in a few minutes. At the same time this factory is operating, we have the reality of prostate cancer. What is it? Simply put, it's when some of the cells within that factory begin to grow out of control. They mutate, they multiply, and they don't follow the normal rules of cell life and death. We know for a fact that certain things increase the risk of this happening. The number one risk factor is age. The older the factory, the more chances for an error on the production line. Family history is another huge one. If your father or brother had prostate cancer, your risk is significantly higher. And we know that ethnicity plays a role, with men of African descent facing a higher risk. These are the established, undisputed heavyweights in the world of prostate cancer risk. But where does a personal habit like masturbation fit into this picture? For centuries, there was a powerful narrative driven by a mix of moral dogma and pre-scientific guesswork that masturbation was harmful. It was blamed for everything from blindness and insanity to stunted growth and general weakness. This created a deep-seated cultural shame, a feeling that this was a vice that would eventually be paid for. And while we've thankfully moved past the idea of it causing blindness, a shadow of that guilt remains, and it has morphed into modern fears. Is this vice going to give me cancer? Let me be unequivocally clear. That old narrative is a relic of a time before we understood human biology. It has no basis in scientific fact. The real error, the real mistake that so many men make is clinging to that outdated sense of fear or shame and allowing it to distract them from the genuine evidence-based factors that truly influence their prostate health. Worrying about this is like worrying that the sky will fall while ignoring the real and present danger of not looking both ways before you cross the street. So now let's get to the heart of the matter. What does the actual, modern, peer-reviewed science say? This is the truth that often gets lost. Over the past 2 decades, several major, reputable studies have investigated this exact question. One of the most significant was a massive study out of Harvard, published in the journal European Urology. This wasn't a small, flimsy study. It followed nearly 32,000 men for almost 20 years. It was a monumental undertaking. The researchers tracked these men's health, their lifestyles, and yes, they asked them directly about their ejaculation frequency throughout different periods of their adult lives. What they found when they analyzed all that data was stunning. It completely inverted the old shame-based beliefs. Men who reported a higher frequency of ejaculation, specifically 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to men who reported ejaculating only 4 to 7 times per month. This wasn't a small difference. We're talking about a risk reduction of around 33%. Let me repeat that because it's that important. The largest and longest running study on this topic did not find harm. It found the opposite. It found a potential protective effect. And this wasn't a one-off finding. Other studies from around the world have pointed in the same direction, suggesting that a more sexually active life, including masturbation, is associated with a healthier prostate, not a diseased one. This brings us to the crucial question, why? How could this possibly be true? While we're still studying the exact mechanisms, there are a few leading scientific theories, and they all make a great deal of sense. The first and most compelling is what we call the prostate stagnation hypothesis. Let's go back to our factory analogy. Remember I said the prostate is always producing fluid? Well, this fluid contains various substances, including chemicals like citrate and potassium. Over time, if this fluid isn't regularly flushed out, it can stagnate. Old cells can linger. And some researchers believe that certain substances within this stagnant fluid could become carcinogenic or cancer-causing over time. Ejaculation is the factory's shipping department. It's the flushing mechanism. Each time it happens, it clears the ducts. It expels the old fluid, along with any potentially harmful substances and older cells that might be more prone to mutation. A factory that has regular shipments is a cleaner, more efficient, and healthier factory. A prostate that is regularly flushed prevents the buildup of potentially problematic materials. A second theory revolves around psychology and the nervous system. We know that chronic stress is bad for our health. It elevates hormones like cortisol and contributes to inflammation, both of which are linked to cancer development. The release associated with orgasm is a powerful stress reducer. It activates the parasympathetic nervous system, the rest and digest system, which counteracts the fight or flight stress response. Could it be that the stress-reducing effects of regular sexual activity and release create a less inflammatory, less cancer-friendly internal environment? It's a plausible contributing factor. A third idea looks at cellular turnover. The cells lining the prostate ducts are constantly dividing and renewing themselves. The theory is that regular ejaculation stimulates this process. By encouraging the shedding of old cells and the generation of new healthy ones, you are essentially refreshing the cellular lining of the prostate more often, giving aged, potentially damaged cells less time to accumulate mutations and turn cancerous. Now, I need to pause here for a moment of critical medical responsibility. It is crucial that you do not hear this and think that masturbation is a cure for prostate cancer, or that if you just do it enough, you're immune. That is absolutely not the case. Science doesn't work in those kinds of black and white certainties. This is a matter of risk reduction, not risk elimination. It's one piece of a very large and complex puzzle. What this evidence does, powerfully and definitively, is liberate you from the fear that this natural act is causing you harm. The weight of scientific evidence points in the other direction. So the truth that many doctors don't take the time to explain is this: you can and you should release the worry, the guilt, and the anxiety you may have carried about this for years. It's not the enemy, so if that's not the enemy, what is? What should you be focusing on? This is where we move from knowledge to action. If you truly want to protect your prostate health, here is your plan. This is what matters. Number 1, the conversation, not just the test. You've heard of the PSA test, the prostate-specific antigen blood test. For years, it was a simple screening tool, but now we know it's more complex. A high PSA doesn't always mean cancer, and a low PSA doesn't always mean you're in the clear. The single most important thing you can do is have an open conversation with your doctor about the pros and cons of screening for you personally. This conversation should start around age 50 or even 40 or 45 if you have a high-risk family history. It's about making an informed decision together. Number 2, eat for your prostate. This isn't complicated. Your prostate benefits from the same diet that benefits your heart. You want to focus on anti-inflammatory foods. Think of lycopene, the powerful antioxidant that gives tomatoes their red color. Cooked tomatoes, like in sauce or paste, make the lycopene even more available to your body. Think of cruciferous vegetables like broccoli, cauliflower, and kale. They contain a compound called sulforaphane, which studies suggest has cancer-fighting properties. Green tea is another excellent choice, packed with antioxidants. And conversely, you want to reduce your intake of processed foods excessive red meat and high-fat dairy, which have been linked to a higher risk. Number 3, move your body. Regular physical activity is one of the most powerful tools you have. Exercise helps you maintain a healthy weight, which is critical because obesity is a known risk factor for more aggressive forms of prostate cancer. It also reduces inflammation throughout your body, improves immune function, and helps to balance hormone levels. You don't have to become a marathon runner. A brisk 30-minute walk most days of the week can make a profound difference. Number 4, know your family history. This is non-negotiable. I can't tell you how many men I see in my clinic who have no idea if their father, uncle, or grandfather had prostate issues. You must ask these questions. If close relatives had prostate cancer, especially at a young age, your doctor needs to know. This information changes your entire screening schedule and action plan. The final truth about masturbation and prostate cancer is that focusing on masturbation is a distraction. The real work, the real protection, lies in these proactive, evidence-based steps. Your health is not determined by a private, natural behavior that has been unfairly stigmatized for centuries. It's determined by the conscious choices you make every day, the food you eat, the way you move, and the open conversations you have with your physician. So let's bring this to a close. We started with a quiet, anxious question rooted in decades of shame and misinformation, and we've replaced it with clarity from the best science we have available today. The fear that you were harming yourself is unfounded. In fact, the opposite may be true. I want you to leave this conversation today feeling lighter. I want you to let go of that specific worry and channel that mental energy into things that will truly move the needle on your health. Schedule that checkup you've been putting off. Have that difficult but necessary conversation about family history. Add more tomatoes and broccoli to your grocery list. Go for a walk. Your health is your greatest asset, and it is built on a foundation of knowledge, not fear. It's built in the light of open conversation, not in the shadows of silent shame. You now have the truth. What you choose to do with it is up to you. Thank you for trusting me with your time and attention on this important topic. If you found this conversation valuable and you want more direct, no-nonsense medical information that respects your intelligence, I invite you to subscribe to this channel. Let's continue to learn and build better health together.